नमस्कार, मैं हूं माही कौर, एक्टर, स्टोरी टेलर, ड्रीम चेजर, बिलीवर एंड टुडे योर होस्ट। आप लोगों ने मुझे कई सारे किरदारों में देखा होगा, बट आज जो किरदार मैं निभाने जा रही हूँ, इट बीट्स देम ऑल, बिकॉज टुडे आई एम शोइंग अप एज द रियल माही कौर, द माही कौर who stumbled, cried in silence, but also slowly rose again. Welcome to High Heels and Healing, where we throw off the mask, pour some tea, and talk about mental health. It's bold, it's beautiful, and yes, it's a little bit sassy, just like healings can be. In this podcast, we talk about mental health. The idea about this podcast came out of a personal journey, my personal journey. When I was shining in the limelight and everybody believed I was fine, inside I was crying. I was hurting in silence. When everyone was glorifying me, my anxiety and my depression were telling me a different story. This is not just a podcast, it's a reminder, a soft landing, a reminder that we are not alone in our mess, in our healing, in our becoming. And in this beautiful journey, which I am going to start today, I couldn't have asked for a better co-traveler than the one who helped me. I would like to welcome Dr. Rahul Khemani, the one who helped me through this journey, the one who is an incredible psychiatrist, who also believes that healing is not only possible, it's powerful. So join me in welcoming my doctor, my psychiatrist, Dr. Rahul Khemani. I couldn't have asked for a better co-traveler because he is the one who helped me through this journey. I cried in front of him. I laughed like a maniac, but he was there, always supporting me, always telling me, always guiding me. And I would like you all to have the same support. So join me and let me welcome Dr. Rahul Khemani. Hello, welcome Dr. Khemani. How are you doing today?
I am doing amazing and thank you for having me here today. I absolutely am honored to be here today talking about mental health, which is my literal favorite topic, which I do almost 24/7, 365 days.
I understand that, and I am actually honored that you accepted my invitation on the very first go when you were all in ki, okay, let's do this. And I've always been, since our therapy began, like I think 2-3 years back, I've always been keen on spreading mental health awareness, and you have helped me a lot during. So before I dive in any further, I would like everyone to know about you. Tell us about your journey. Why this field, particularly?
So, yes, being a doctor was easy. My elder brother is a cardiologist,
Yeah.
and I was natural to follow in his footsteps. We are the first doctors in the family, and
Oh.
also till now, the last ones, none of my brothers or cousins ever went ahead to become any more doctors. But it was an exciting journey to become a doctor. And then after we finish our MBBS, our graduation, we are given internship where we practice in every field specialty for almost a month or 1.5 months or 15 days.
Right.
And in the 15 days of psychiatry, I was highly inspired when I saw one of my professors taking history, talking to a patient. I was finding it very interesting the way it went deeper into the mind, and we found so many answers. And I found that these illnesses are a mystery to solve. And I've always been a fan of Sherlock Holmes. And as a detective, I think this was one of the most intriguing mysteries that I wanted to solve always. In fact, surprisingly, the two choices that I had at the end of my MBBS were either surgery,
Okay.
which again is a mystery of the body, or psychiatry, that is mystery of the mind. But at the end, when I came to choose, I wanted psychiatry because I thought this is something I can probably do better. And once I entered into it, there was no looking back because I kept loving it more and more. I went into South to do my psychiatry. I was in Tamil Nadu. I learned the language there, and then I started my counseling patients and going through the treatment process and everything. And it was lovely because I think South has much better awareness, much detailed way of going into mental health treatment. They have very good hospitals, and I've always wanted to go there and learn And when I learned all that I had to do about mental health, I came back to Mumbai. I joined the government hospitals here. I worked in the government hospital of Sion, Nair Hospital, and even worked in multiple hospitals before I came down to start my own clinic with my brother, which is Heart and Mind Clinic, which the name suggests, as the heart part is my brother and I'm the mind part. And since then, again, I've just kept on growing from there, taking in sessions, consultations, and so on. And I've primarily worked a lot into this process. But yes, I've always wanted to do a lot of awareness, because mental health awareness, as you really understand and know, is very limited.
I personally feel it's about time that we get into it. We need to tell people that this is not you just say कि okay, अरे सब ठीक हो जाएगा. It's in your head. No, okay, it's in our head, but something is bringing it out in us.
Absolutely.
That is what I want people to understand, because when I was going through it, and I had some, pardon my language, I had really shitty days. I couldn't get out of bed. And then if somebody is calling me, they're like, अरे अच्छा सोच सब ठीक हो जाए. भाई मैं अच्छा सोच रही हूँ, वो आ नहीं रहा. So that part I want people to understand.
Really said the words of the mind. Literally, this is how every mind who's going through problems experiences and speaks. But they're not able to say it to our family, caregivers, loving people. Nobody listens to these things. And when they listen, they say, you're not trying hard enough.
Exactly. And, at times, we want to share things. We want to tell someone, like my friend is calling me, or if my sister is calling me, and she's like, क्या हुआ? बताओ सही क्या हुआ? And I don't know कि मैं बताऊं कैसे, because in my mind I'm thinking कि नहीं यार, ये समझेंगे ही नहीं. ये समझेंगे ही, वो maybe they'll understand, maybe they won't, but how do I, क्या बोलूं उनको, मैं क्या करूं कि कुछ तो समझ में आए.
Precisely. Even the closest people to us are unable to understand this, because there are no visible signs to it.
Exactly. So, how long has it been since your practice began?
So overall, I've been practicing almost for the last 10 years now, a decade done. And my clinic practice is the last couple of years, particularly COVID.
Yeah.
Because after COVID, I wanted a separate place. I wanted a safe place where people could come and talk to me. And I designed my place. You've seen it.
Yes, I have seen it.
There is a nice sofa which I've always dreamt of. I've always wanted a particular way of my place being where people can come in and just feel calm.
Yeah.
And again, I think I've been into this practice for more than a decade also, probably because in my internship also I was very active in it. But yes, as a psychiatrist, I've been practicing for the last decade.
That's wonderful. I particularly, I'm really glad that I met you, and I'm really thankful and grateful to you that you have helped me through my journey. So let's dive in a little deeper now. My first question to you would be, how would you define mental illness?
A very good start to understanding what mental health is. So as we understand, we've always heard this word health. And whenever we hear the word health, the first thing that comes to our mind is physical health, the health of our body. We go and check our blood pressure, we go and check our sugar levels, our hemoglobin levels, our liver, kidney, all this, the chest x-rays and ECGs and so many things. But have we ever gone through a routine psychiatric checkup? Never.
No.
We don't even think about it. In fact, the first thing that comes to our mind is, "Main ka pagal hu?" And this word is absolutely criticized nowadays.
Yes.
In fact, we don't use that word anymore. So these are things that family members tell the ones who want to go for a routine checkup. In fact, fortunately, I've had so many people nowadays coming in, the younger generation, because they've become more aware about it. They've become more comfortable talking about issues related to it. So yes, coming back to our question, now mental illness is not exactly the opposite of mental health. A lot of people do get confused with it. In fact, a lot of people say mental health means the absence of mental illness, but that's again not true.
Okay.
So just like how there is a physical health, the health of our body, everything that we do for our body, there is a particular part in our system called the mind.
Yeah.
It's not a physical part. You cannot define it physically. You cannot, it doesn't have edges, it doesn't have a structure. It is a system inside the brain. And that system, based on neurochemicals and neurochemistry, is the part which thinks, feels, and thus behaves. These
Okay.
three parts. And based on these three things, we define our mind. And the same mind has a health, which we call it as mental health.
Okay.
So sometimes mental health can be slightly disturbed, and it is not to the level of a mental illness. So how do we get to the part of mental illness? We define anything as mental illness when the part in our body has functional problems. For example, if I'm not able to meet up with my friends, if I'm not able to go outside my house, if I'm not able to work adequately, if I'm not able to study properly, if I'm not able to do the functions that I'm supposed to be doing, that's when mental illness comes into play.
But how do you differentiate? Like you said, I don't go out to meet my friends. Okay, I don't want to study or I don't want to do anything else. तो ये कैसे पता चलता है कि you have mental health problem or you are just being difficult or lazy?
Very good. So we have a comparison. So there are some people who are introverts, they don't like to go outside, or they're lazy, as you correctly said. So those people will never do it. And from the beginning, they won't do it. So they won't matter. They won't think about it. They won't worry about it. And they'll be fine. And they won't consult somebody. And even their family members will know that this is normal. But someone who's been very proactive, going out, meeting with friends, going and playing, doing all the things very actively, suddenly in the last 1 month becomes very lazy, doesn't go out, doesn't talk with anyone, just like the way you had, remember, felt when you suddenly started to feel very emotional without any reason. You did not understand what is going on with you.
Yeah.
And you couldn't talk to people even though you loved talking to people. So that is the way we have a comparison, we have a benchmark from before. And if there is no benchmark, then there is no consideration into it itself. So this is a very important question that we ask when we are taking a history. That was any of these things there before, or they have been there from childhood itself? So a lot of parents actually bring their children, and I ask this question, and they say like, they're from the beginning like this, and they're like, so these are your expectations then.
Yeah.
And your expectations might not match because this is the way the brain is made up right now. The genetics and everything, the environment has made the child or the adult into that way, and that is fine. So the child or the adult can be that way, and there is also all these natural fluctuations in emotions and behaviors. So that is fine. But as soon as you realize that there was a part of you which was there and it's not
Which
now,
is now missing.
then it's when we define it as mental illness, because we want to bring it back to that state. We want to feel that way again. So just because someone does not talk to someone or does not go out does not mean that they are sad.
Yeah.
In fact, this is a very good differentiation that we use as well. So a lot of people confuse sadness with depression.
Exactly.
But sadness is naturally there. Sadness is an emotion. If any of us have seen the movie Inside Out, that's actually something that defines our natural emotions. So happiness, sadness, anger, disgust, jealousy. There's so many natural emotions. I mean, if we go to define the natural emotions, it will be endless.
Correct.
And having these natural emotions are necessary. And it's important if I fail in an exam to feel sad. Because if I feel sad, then I try better next time and I try to pass, and then I go towards happiness again. But I cannot sustain happiness all the time. So this is again a confusion that a lot of people have. Should I be happy all the time? Obviously no. Should I be sad all the time? Again no. Based on my experiences.
Correct. We have lots and lots of emotion that we process every day. And that is what I was going to ask you, ki, how do you differentiate between sadness and depression? At times you are just sad. You wanted something and you did not get it, और आप एकदम से उदास हो गए, but सामने से किसी ने बोल दिया, अरे यार ये तो 2 दिन से उदास है, ज़रूर डिप्रेस होगा. What is this?
Precisely. Nowadays, it's actually the over part of it now. That people have become over aware into that, and immediately they feel that this is something wrong. But so in fact, a lot of people when they're going through a breakup or when they have just gone through a failure in job or something, have come to me. They tell me that I'm probably depressed, and then I sit down and talk with them, and then we realize that this was incident based. This was trigger based. This was stressor based. See, sadness is time bound.
Yeah.
Sadness is temporary. Sadness has a start and it also has an end. It goes away after a period. And that is why sadness is normal. But depression is endless. It's an endless pit of
Yeah.
darkness.
Correct.
It is persistent. Nothing that you do, even if you get the things that you wanted, maybe you wanted a PS5, maybe you wanted all the money in the world, but nothing makes you happy in that moment. You are just sad. You cannot define it why you are sad. You're probably constantly feeling like crying. You feel very hopeless. You feel helpless. Nobody can help you. Even though you're surrounded by a million people around, you still feel very lonely.
Yes.
Sadness in the extreme way and uncontrollable way is actually depression.
Yes.
And that is the chemical way of sadness. A natural sadness would be just temporary and it would normally come back.
Correct. So the first lesson to understand here, as per me, would be before going to a psychiatrist or before consulting someone, understand that you are sad or you're anxious or you're actually depressed. Don't tag everything ki अरे सब कुछ depression है, सब कुछ depression नहीं है. It could be sadness.
Precisely.
It could be that you are missing some moment
In
or
fact,
something.
a good point over here is that a lot of people get confused between sadness and depression, anxious and anxiety disorder, because it is the same spectrum.
Yeah.
See, in other illnesses, so there is a problem, there is not a problem. For example, I have a high blood pressure, I don't have a blood pressure. I have a fracture, I don't have a fracture. But in anxiety and depression, it's the same spectrum.
Yeah.
So I could be just one leg away from anxiety disorder. So when does anxiety, normal anxiety, which I can feel when I'm probably crossing a road,
Yeah.
I can feel anxiety when I see a barking dog, anything can make me anxious, but when does it turn into anxiety disorder? So this was what I began with. The social and the occupational dysfunction. So if I'm scared of dogs, that's fine. But if I don't step out of my house citing that I might get bit by a dog,
Yeah.
and I don't leave my house at all, whatever come may, even if people come and pull me out of my house, then it becomes a phobia. And that is an anxiety disorder in its own extreme way, and that is when it becomes a problem. So I can be scared of things. I can be scared of lions. I can be scared of falling from heights. But as long as I continue with my daily routine, that's fine. But as soon as I have to go for international trips for my job, and I can't do it anymore, now this is where it becomes a problem. And that is when people come to me for treatment.
Yeah.
So we have both therapy options, we have both medicines as well. And that happens and we solve it. So this spectrum is a problem, because in this spectrum, some people, when family members come in, they tell me, don't start treatment, doctor. We don't want medicines. We think this is normal. So it is very difficult to pinpoint on which point in the spectrum they have a problem.
Yeah.
And that is why the treatment part becomes difficult, and even the awareness part becomes difficult, because we have always been taught feeling a little sad is normal as well. But then we don't know where that line is, where we are on that spectrum. And that is why people sometimes don't even come for treatment until it becomes so severe, they end up doing something very disastrous.
Yes.